Buenos días, mi gente, la doctora Mirella con ustedes. Do you know that while women are somewhat equitably represented in Alzheimer's and dementia clinical trials, we still underrepresented as we still represent 64 of the dementia population in the nation. So one component that I wanted to highlight today in this Háblame Claro is to engage the research teams in biomedical institutions such as UCLA where I work, and ask them about not only the representation of women, but also ask them about the research design and the analysis that they're projecting to do. Because one component that the science is telling us that despite the somewhat equitable representation of us as women in clinical trials, when we talk about data analysis to see if there's biological sex differences in efficacy and safety, those analyses are typically not done nor published. There are also some studies that are reporting that biological sex characteristics of the research sample are also not reported. So which means that despite the equitable representation and the argument that they're doing great in quote unquote diversity, we are lacking at understanding the differences of whether the intervention is actually working or not, and that the characteristics are obscure. So next time that you engage with a physician or research team, ask them those questions, because at the end of the day, you are participating, but when it comes to whether that applies to us as women in terms of precision medicine and whether they work or not, the data is still lacking, okay? So in this month of Women's History Month, let's ask those questions and see how they respond. So with that said, mi gente se me cuida, and I'll talk to you soon. Bye.